Well, it started 2 years ago or so. I was 30 years old. And I had a day where I went on a long run, played beach volleyball, and the next morning I woke up and couldn't walk. My left foot was in too much pain. This was 1 week before my wedding, so it was a little bit of a stressful situation, but I got an x-ray and there was a broken bone, a small bone in the ball of the foot called the sesamoid bone. They told me 8 weeks in a air cast, air boot, and I should be better. So it didn't let me bother me too much then, but 8 weeks came and went, and I still was in a lot of pain, and didn't really get better. Several months later, the same thing happened to my right foot, and at that point, I couldn't really walk at all anymore. I was either on crutches with boots on both feet, sometimes in a wheelchair. I developed red burning pain on both of my feet, especially at night. That was very painful. Eventually I was diagnosed with complex regional pain syndrome, which is a little bit of a scary diagnosis. But I tried everything I could to get better, and it just wasn't happening. A few months ago, I couldn't be standing or walking for more than maybe 2 minutes. My mobility was just severely limited. We had a hospital bed on the first floor of our house for many months that I was sleeping in. Went on vacation with my wife in just January of this year, and we brought a wheelchair for her to push me through the airport and to go around the hotel in. So this injury or injuries had really just taken over my life. I didn't have my mobility. It was really hard to make social plans with friends. I had to say no to a lot of things. I was very, I did a lot of physical activities and hobbies beforehand, running, rec sports. I like to golf a lot, even traveling and walking around cities. All of that kind of stopped once these injuries started. Before coming to Dr. Panjwani, I tried almost everything that anyone suggested that I try, from a change in footwear to custom orthotics, steroid injections. I was in boots on one or the other or both feet for many weeks, used crutches. I had months and months of physical therapy, and I ended up having 3 surgeries, 2 on one foot and 1 on the other, that did help, but left me nowhere close to where I wanted to be. I still had big issues with mobility after the surgeries. So I was kind of at a loss of what to try, and eventually I found Dr. Panjwani. I was part of a Facebook group for people with sesamoid disorders in their feet, and someone suggested reading the book called The Way Out by Alan Gordon, and I ended up buying the audiobook and listening to it in a couple of days, and it completely opened my eyes to new perspectives on pain and new treatments for pain. So I was not familiar with chronic pain and the differences between structural pain. My understanding was something happened to your body, there was an injury, and you feel pain. But it turns out that's not the case. You can, over time, develop chronic pain, which is unrelated to structural pain, where your body is okay, but you're still feeling pain. And the treatments for that type of pain are very different from the treatments to structural pain. So the book talked about pain reprocessing therapy as a very effective and new way to treat chronic pain. And I ended up finding Dr. Panjwani in my area, who was highly rated practicing pain reprocessing therapy. So I figured I would try it out and see if it worked for me. By the time I found Dr. Panjwani and decided to try treatment with her, I tried everything else, and her approach using pain reprocessing therapy didn't use drugs. There was really no risk to trying it out. So while maybe I had small amounts of skepticism in the beginning, I decided I'd move forward with treatment, and my skepticism evaporated very quickly as I immediately started feeling results. On my first day, she assessed me like a physician would. She looked at my records and structural issues that I had in my feet, my surgeries, my other symptoms that I'd had. And moving forward, in addition to pain reprocessing therapy, she was kind of treating in other ways as well. And one of those ways is the photobiomodulation laser, which I believe has been very helpful for me. Pain reprocessing therapy is also a very huge part, and I think that she, from what I'd read in my book, she also kind of goes above and beyond. And I learned she'd actually been treating using a version of PRT before the term pain reprocessing therapy was even around. So she has a lot of experience treating pain in this way. I have to say that since I started seeing her, my improvement has been huge. I was walking less than 1,000 steps a day for many months before seeing her. In the first 2 weeks, I was up to 4,000 or 5,000 steps a day, and now 10 weeks later, I'm easily walking 10,000 steps in a day. I can be on my feet for very long periods of time. I can go out and see friends and not feel limited by my physical limitations. I've gotten back to going on walks around the neighborhood, playing golf again, riding my bike, swimming, getting mobile. My emotional state has been greatly improved as well. I was having a hard time during the process of not having much mobility for a while, and kind of using some strategies I've learned from Dr. Panjwani, along with my physical improvement, my emotional state has been greatly improved. Over the course of the 10 weeks I've been seeing Dr. Panjwani, it's been a gradual but significant improvement. And it's the little things too. It's gone from feeling less pain and less tightness while I walk, to the red burning sensation basically disappearing. I don't feel that at all anymore, which a couple months ago I never would have believed that in just the course of a few weeks that would be gone. And it's little things around the house. For instance, I slept with my feet propped up on a pillow for the last 2 years, and I'm realizing that I can stop doing that now. My feet would get too hot from the burning sensation to be under the covers at night, and now they can be under the covers. I would sit to shower for many months, and I've realized now that I can stand barefoot again in the shower. So it's little ways like that that my life is just getting back to normal, and I completely attribute it to this treatment. I was taking a good amount of gabapentin, which was diagnosed for CRPS when I started with Dr. Panjwani, and we've actually managed to wean myself off of the medication with no negative side effects. So I think it's really cool that everything that I've done to improve with Dr. Panjwani has been without the assistance of medication of any kind. Physically, I'm getting back to where I want to be. And while I still have a little bit of a ways to go, I feel like I'm so much closer than I was before. Already, I've started to go on long walks with my wife and daughter around the neighborhood. I've gotten back on the golf course. I even played 18 holes for the first time a couple days ago. I'm riding my bike for several miles at a time. And I think now it's a very realistic goal for me to be starting to run again soon, play tennis, start playing sports again. I think 6 months ago, I wasn't sure I would ever do that again. And now I know I will. It's just a matter of time until I can. As far as advice, I would say if you've been experiencing pain for longer than 3 months or longer than most doctors think you should be experiencing the pain, really educate yourself and try to figure out if you might have chronic pain, because If you do, I would 100% recommend looking into pain reprocessing therapy, because I do believe it works. I think it's proven that it works, and for me, it's really given me my life back. I would definitely recommend Dr. Panjwani to my friends and family, or anyone on Long Island or the surrounding area. She's fantastic. She really knows what she's doing, and she has a proven track record. Couldn't recommend her more.